Hello, my name is Ashley Saucier. I'm the Family Medicine Clerkship Director, and I am going to be talking to you about our new Clerkship and Enrichment end of course evaluation in a brief training session. So the MCG 3+ curriculum redesign, which started for the class of 2024, during that time, we have been evaluating how and revising how we assess our students on the competency-based objectives. The class of 2024 will enter into the clinical year starting in January 2022. Therefore, we took the opportunity to revise our end of clerkship course assessment form in the clinical and enrichment years for the following reasons. The MCG competency-based objectives have been updated, and our form needs to reflect these new MCG competency-based objectives. We want to align our clerkship assessments by integrating a forms of assistant model used currently in the pre-clinical years to emphasize learning as a developmental process. And lastly, we hope this form will be more intuitive for you as the assessor and provide more valuable feedback for students. In the preclinical years, students have been using assessments with rating scales based on assistance and independent performance of targeted behaviors. This model is based on developmental learning theory, where a zone is the space between what a learner can achieve with assistance, which is guidance or encouragement from a skilled partner, and what a learner can do with little to no assistance or independently. Learning a new skill involves a learning curve where we develop independence over time, and this is facilitated in part by strategic guidance from educators and others to assist in learning outcomes. So, as students progress toward mastery of a skill or a competency, we need to provide them less assistance over time. So let's put this in the context of the clerkships. Students will come to your rotation with prior experiences from their pre-clerkship months and prior clerkships that have contributed to their current knowledge or skills. And what a student learns on their rotation then becomes their prior learning that they take with them into the next rotation or into residency. Your clerkship is here. Your clerkship is the zone where students receive assistance from you over the course of the clerkship to build on their current knowledge and skills. They then take those experiences, as we said before, and they build upon them for the next clerkship. Now that you have this important background about the zone, I'm going to briefly take you through some important details from our clerkship and enrichment assessment forms, so you will be ready to use them once you encounter our students. It would be helpful for you to have a computerized view of the new assessment rubric or a printed version in front of you, so that you can sort of look through it as I'm talking to you about different things. So on this slide, I've just placed just a piece of part of our new clerkship and enrichment assessment form, but hopefully you have the entire thing in front of you that you'll be able to look through now and also over time. And so this piece is just so I can demonstrate a couple of important details. So the first thing is our rating scale. This scale is broken down into the following: unable to perform, needs significant assistance to perform, needs little assistance to perform, or needs no assistance to perform. There is still a not observed option for those competencies that you do not observe and do not feel that you can adequately assess your students on. We are asking that you rate the students on how much assistance they need to demonstrate a targeted behavior at the end of the clerkship rotation. Now, in some competencies like developing differential diagnosis or coming up with treatment plans, students may start out needing significant assistance to perform this skill, but it is our hope that over the course of the clerkship that they will that we expect for them to progress so that they will require less assistance, which will be little to none, in order to perform that skill. There are going to be some competencies on this form that students should be able to consistently demonstrate with little to no assistance, including developing positive relationships with patients or demonstrating honesty, integrity, and ethical behavior. But remember, the key to this new scale is that we are asking you to rate students on how much assistance they need to demonstrate a targeted behavior at the end of the clerkship rotation. Now you may be asking, how do we provide assistance to a student in a clinical setting? This is merely just a recognition and rethinking of what you already are doing. So here are some general examples. Explaining your clinical reasoning and approach on developing an assessment and plan. Providing the student with feedback. Prompting the student to expand their differential or devise a treatment plan. Providing information to fill in medical knowledge gaps. Showing students how to perform physical exam maneuvers appropriately or how to perform procedures. Asking them questions to fill in missing information during an oral presentation, or directing students to the literature or to evidence-based medicine so that they can learn about their patients. There are examples that are specific to each competency domain on our assessment instrument. And here for professionalism, I've just highlighted where it would be so you can get an idea about where it would be located as you go through your form. These are in no way comprehensive and exhaustive in any way. So please remember that this is only meant to be examples for you as you start becoming more comfortable with thinking about how you provide students with assistance in the clinical setting, but it is by no means an attempt to determine all the ways that you might provide students with assistance. The competency-based objectives that you are evaluating your students on may look fairly familiar, but there are a few things that I want to point out. Professionalism continues to remain a key area where we expect consistent excellence from our students. Therefore, if any student needs significant assistance or is unable to perform in any domain of professionalism, they will earn a D or an F in the clerkship and will require consideration for remediation. There is addition of new competency-based objectives to this form as well. In the area of communication and interpersonal skills, there's a new competency-based objective called participating in patient education. This involves the student educating patients on basic prevention strategies and healthy behaviors, discussing medical risks and benefits, or in clerkships that are more procedurally oriented, it could be participating in informed consent. Another new competency-based objective area is in community health and advocacy. So for our clerkships and our enrichment years, we are asking that you also look to see if the student can identify common societal problems that affect the health of patients. In other words, what this means is the student able to identify risk factors and link common societal problems like tobacco use, obesity, poverty, other social determinants of health to a current patient's healthcare problem and how that may influence the outcome in oral presentations or documentations. So for example, do they recognize how obesity may be contributing to the patient's diabetes, or do they recognize that tobacco use may be contributing to a patient's COPD, or do they recognize that there are financial assistance or financial barriers that may be contributing to a patient's adherence with medications due to the inability to afford medicines. And those are just some brief examples. Finally, narrative comments are still mandatory and very important, as this is what helps to form the narrative summary developed by clerkship directors for the medical students' medical performance evaluation seen by residency program directors. However, we have added an optional section for you to have as an opportunity to really highlight those students that go above and beyond by identifying any competencies that a student demonstrated at a level that puts them in the top 5% of all students that you have worked with in the past year. This will really give us as clerkship directors the ability to make students' medical student performance evaluations really unique to students' strengths. Now, I know you all may be wondering, how will this be graded? As we are all sensitive to making sure that that our students are successful and receiving appropriate grades. Please know that the curriculum and assessment team are working hard to ensure that the grades assigned via this assessment rubric will be appropriately distributed according to students' expected developmental level. And additionally, we will closely monitor student performance over the course of the year. Thank you so much for all that you do for our students. We really hope that this training provides you with the opportunity to provide quick and valuable feedback to our students using our new clerkship end of course evaluation. After you review this presentation, please proceed to the inter-rater reliability exercises that we have given you to perform on the email sent out by our team. This is critical because we have to make sure that we are using a validated and reliable assessment instrument for our students. Establishing inter-rater reliability means that we can show that we are all using the instrument in a reproducible way. And if we can make sure that us as clerkship and site clerkship directors are using the rubric are using the instrument in a reliable fashion, then we know that you'll be able to teach our faculty distributed across our wide geographic network how to use it as well. In the email, we have provided you with 3 different student scenarios of students performing certain competencies that you might see on a clinical rotation, including a history and physical, an oral presentation, and a note. Please understand that these are 3 different patient cases from 3 different students. So please don't let that stress you out. Just treat each one as a different student and encounter. After you review each section, please fill out the appropriate survey on how you would rate the student. Once complete, we will determine if we've reached the appropriate inter-rater reliability. And if so, we're done. If not, then what we will do is send out an additional exercise with some additional training in specific areas where there wasn't as much reproducibility on our rating. Again, thank you for everything you're doing for our students. Hopefully this inter-rater reliability exercise won't take you that long. We anticipate that it may overall take you about 30 minutes to complete. Thank you.